unloading the syringe is very easy. I like to take the anesthetic out first because when you're taking the needle off, if it's still in this anesthetic, it can be easy to separate the cap from the needle itself. Okay, so I like to turn this upside down, pull back on the plunger. Okay, it should just fall out. If it doesn't, you can use your fingers right here, grab the anesthetic and pull it back. Then it should come out. If it just kind of falls out, you can grab the anesthetic like this and pull it. Now you got to be careful of this spear right here. Make sure you're not still touching this when you put this back in. Then, to take off the needle, we unscrew it while we push in. You always push on the cap. You never ever pull for any reason. So as we're pushing in, we unscrew it. Then when you're 100% sure that this is off, you pull from the white portion only. The reason that we pull from the white portion only is because the colored portion is the cap and it can come off. So we grab the white portion and we pull it apart. Put this down. You grab your cap. You do the scoop method, right? I'm sure that I have it. And then I grab it from the sides to put it back on. That's our syringe.
And what do you do with a used needle?
Okay, so with a used needle, no matter what, it always goes in the sharps. It should never, ever go in the trash. The sharps container should be in every operatory, and it should be in sterilization. You shouldn't carry any of these out of the operatory. It should be disposed of as soon as you're done using it. I don't like to even leave the used needles in the room while I dismiss the patient. I like to get rid of my sharps before me or anybody leaves the room in case another person comes in to help us clean up. We don't want them having to come across used sharps. So make sure that it always goes in the sharps container. We don't want to put anybody, ourselves or anybody down the line, including the people who clean up at night, the people who take out the trash, the garbage men or the dump workers, to be at risk of contracting diseases because we put these in the trash.
And what about the anesthetic carpule?
The anesthetic carpule, if it's completely used up, can go into the trash. If it's only partially used, it needs to go into the sharps container. This is because it has chemicals in it. They don't want chemicals going into the trash. So if it's completely used, trash. If it's partially used and there's any anesthetic still left in it, it goes in the sharps container as well as if it's broken.
Or if it has blood.
Or if it has blood.